So there's this topic I've always wanted to talk about. It's about abortion. Yeah, I know that this is a very sensitive topic because, of course, in our country we're very religious people, and this is a sensitive topic. But I'm not going to be talking from a religious angle. I'm going to be talking from a medical angle. Okay. So let's get right into it. What is abortion? So abortion is the termination of a pregnancy. Abortion is the termination of a pregnancy before it's able to survive outside the uterus, outside the womb, which is usually 20 to 24 weeks. So we have two types of abortion. We have the spontaneous abortion. This is known as miscarriage. This happens naturally, unexplained, it just happens. So the other name is miscarriage. While the second type of abortion is induced abortion. This is the intentional act of ending the pregnancy. It's either by pill or medical procedure. What the medication does is that it blocks the progesterone and then causes the uterus to contract, and then the cervix opens and expels the product of conception. That's what the pills does. While the medical procedure is done by a healthcare professionals in a hospital. This way they use the MVA, the manual vacuum aspiration procedure, dilatation and evacuation procedure. But that is done by healthcare professionals. So there are several reasons why people do abortion. It could be for medical reasons. The pregnancy could be a risk to the mother in the case of where there is uncontrolled high blood pressure, diabetes, bleeding and all of that. Service is just incompetent service and everything is just flooding out and the mother's life is at stake. Cases like that can be a ground for abortion. Unplanned pregnancy, rape cases, condom breaks, and all of that. Contraceptive failure. Some people, might protect themselves and the contraceptive fails. Severe fetal abnormalities. Some people would not want to go through the body of getting a child that is deformed. Personal reasons, financial instability, if abortions are generally safe, very safe, especially when it's done by a healthcare professional, a trained healthcare professional in a hospital. But on ovulation literally return in 2 to 3 weeks, the ovulation is back. So you can even still have an abortion this month and get pregnant the next month. So you can still go on and have as many children as you want. An abortion is not a form of contraceptive. You do not need to wait to get pregnant, then you terminate it. You can protect yourself. There are different forms of our contraceptive, but unsafe abortions, herbal mixtures, and all of that can lead